So thank you for the invite. It's always a pleasure to talk about STIs, and maybe this is very different to the morning sessions, but I think it's really important, and I want to talk about my clinic in particular, which is 56 Dean Street, which is the busiest STI clinic, we think, in Europe. So just to give you the picture of healthcare in the UK, when you test for sexually transmitted infections at a public service, everything is free. So tests for HIV, syphilis, chlamydia and gonorrhea. And it's paid for by local authorities. And if you have linkage into care, which in STI clinics is very often on the site of the clinic, that's also free. So all HIV medications and testing is done free. And actually, it gives us the ability, if you're diagnosed with HIV in our centre, you just go upstairs and you can start your treatment and management of your HIV very quickly. Okay, and I think that's really pertinent to the model that I'm about to present. So I'm going to concentrate on this graph, which is phenomenal. I've worked at Dean Street for 6-7 years, and it's been a real privilege to see for the first time ever in an urban city that there's been a rapid plummet in HIV diagnoses, particularly in gay men. And if I tell you that Dean Street accounts for 1/4 of all the gay HIV tests in England, then I think something about our model of care is responsible for this fall. So what do we know about HIV? What do you know about HIV? So new infections in gay men. So I'm going to concentrate on gay men. So the majority come from people who don't know that they have an infection, and in particular those who are passing through primary HIV when their viral load is very high. So it's important to identify undiagnosed HIV, and in particular people who are seroconverting, and that can be quite difficult. This, I think, is really interesting. There is a sort of a vogue to say that once you tell someone they're HIV positive, they're not going to have sex. And actually, just telling people they have HIV is enough to intervene to stop the transmission cascade. Well, the majority, yes, will not put others at risk. But actually, this is from a while ago. There is a significant minority of people who will have unprotected anal intercourse. We also know that if you have undiagnosed HIV, that if your virus is unsuppressed, then STIs, particularly genital ulcer degrees, can facilitate the transmission of HIV. And of course, very topical from 2 weeks ago in the press in England, in particular, the Partner 2 study. And, you know, this is really difficult to get into people's heads, even physicians' heads in England. But the risk of HIV transmission through anal sex when HIV viral load is suppressed is effectively zero. So let's bring all of those things together. And something that we wanted to do at Dean Street was to reduce HIV through reducing undiagnosed infection, be it chronic or primary infection. Once your HIV is diagnosed, to suppress your viral load as soon as possible, and to treat other cofactors, STIs, and of course, to talk about prevention, which I'll talk about in a little while. So what did we do? So this is Soho. It's a map. It's a bit bland. We didn't start out in Soho. It's almost 10 years to the day that we moved there. We were in a tiny, awful, small clinic in West London, and one day a week we did an outreach clinic in Soho where we diagnosed half of all our HIV. So there's something about the clientele that came to that outreach service which meant that undiagnosed HIV was there in Soho. And at about the same time, research that was done in gay bars in urban centres in Britain showed that actually, certainly in particular in Soho, 1 in 20 gay men in those bars had undiagnosed HIV infection. So there's a public health emergency there. So our big plan was to move the clinic into the area with the undiagnosed HIV. And I guess in this talk, I want to talk about themes really in particular, about if you're thinking about testing for STIs, what you could do. And for us, going into Soho was really important. And it wasn't a given that people would come and test where they go and drink, but I hope I can convince you that that's where they are testing. So for those of you who've never been to Soho, this is Soho. So this is outside our clinic, and I want you to know that it's a diverse area. So over my right shoulder is the entrance to Chinatown, which is a stone's throw away. Over Tara's right shoulder is the church, which actually owns the centre that we rent. You can tell it's a very diverse, accepting area. And there's Prowler, which is a gay sex shop that's 2 steps up the road. So we have very, very many different things in this area. So the environment is also important. If you want people to come and test, you have to make it inviting. This is a series of pictures of STI clinics throughout England, and they all look fairly similar. They're often prefabricated buildings at the back of hospitals. So what I want you to know by that is they're not very inviting, and they're hard to get to. So we came up with, some people describe it like a first-class lounge. This is 56 Street, so branding is very important to us. The main centre is here at the bottom, so on the first 2 floors we do screening for symptomatic STIs. If you are HIV positive, you can go straight up to the 2nd floor where we have a pharmacy, and you can be seen by us clinicians as well. The picture here is, it's not a hairdresser's, although it looks like it. It's Dean Street Express, which is our service for doing asymptomatic screening for STIs, and I'll describe that here. So this is what it looks like inside. It's deliberate. It's deliberate to look inviting, to look clean, to not look clinical. We wanted this model to be as affordable as possible. So traditionally for HIV and STI screening, it was physician-led, but actually at Dean Street, if you don't have symptoms, you are seen by nursing staff or healthcare assistants, which actually cost less to the NHS. You go into reception, which is here, then you go to the touchscreen, so there's no paper, it's all done on a computer. You swab yourself, you get the patients to do the work for you. There are videos here telling you what to do, and this is all done in cubicles at the back that are themed to represent Soho. They go onto the Gene Expert machine by Kefid, which the minute that swab goes on the machine, it starts to run, and 90 minutes later, those results go back through the computer system and get texted to your mobile phone. So actually, it's not uncommon for you to get your results possibly while you're in clinic, although you hope that you're in and out in half an hour, but certainly while you're still in Soho, and then you can come back in for treatment. And we've done some work to suggest that there are public health benefits in treating people very quickly. Okay, so this is the reproducibility of Dean Street. It's not uncommon for clinics at the bottom to result their STIs and inform patients in about 2 weeks, 10 days to 2 weeks. In Dean Street, we're able to do that in a matter of hours. So the paradigm has shifted from giving people their results in days to hours. So what? Now, clearly people liked it, people came to the clinic. This is a graph showing month-on-month growth. It's very convincing. You'll see that there's a dip around Christmas, and then in the new year people come back to London and retest. The same happens around August when people go to the Mediterranean. The line at the bottom is our symptomatic testing, which is at 56 Dean Street, which stayed stable throughout the testing. Okay. So this, to me, is the graph that's most convincing of the model of introducing frequent testing to high-risk populations. So when Dean Street Express opened 5 years ago, we upregulated testing. We were encouraging people to come and test more frequently. It was not uncommon for gay men who have 200 partners in 3 months to test every 3 or 4 weeks. And what we saw was case finding. The numbers went up, and then as the tests stabilised, the numbers and the incidence of HIV went down. There's a problem with this, though, and the problem is the reproducibility. So just look at the number of tests. This isn't economically, or even as a service model with your staff, reproducible long-term. We test around 150,000 HIV tests in our centre every year. And for you to convince your commissioners to create a service to do that is quite challenging. And certainly in the climate now, where HIV incidence is falling in high-risk populations to below 1%, that's ever more challenging. So we have to think about strategies going forwards to provide HIV testing to those particularly at high risk, and I'll talk about that now. So my little GASPER there is showing combination prevention as we provided at Dean Street. So a few people have come up and talked to me about chemsex support in particular. We have quite a problem in London for people using recreational drugs in the context of sex, which increases their risk for HIV and other STIs. We have a particular service run by David Stewart which provides support for people using chems. We traditionally in all clinics in the UK have health advisor support around risk reduction. Of course, PEP and PrEP, I'll talk a little bit about this. At Dean Street, we give out a third of all England's PEP. Woe betide you if you're the doctor who's on a Monday evening when everyone gets up to get their PEP for the weekend. We see a huge amount of PEP, and increasingly we're seeing more PrEP users. We've got about 6,000 people that we monitor who are using PrEP. We were early adopters of test and treat. I'll talk about that in a minute, and I'm going to talk now about targeting high-risk MSM, in particular for testing. So we came up with a web-based tool called Prime, and so we did some work around 5 years ago looking at markers of particular high risk in our MSM population. So it's no surprise to me that if you have a rectal gonorrhea or chlamydial infection, that your risk of HIV 5 years ago as a gay man was about 1 in 10. But we also found that with early syphilis, and surprisingly to me, PEP users, if you came in for PEP, actually your subsequent risk of acquiring HIV was high. So we came up with Prime so that people could walk into the clinic even when it was busy and get tested. And it's a package which gives people advice around risk reduction. We invite people to choose ways to decrease their HIV risk, some more convincing than others. I don't think many people go for abstinence. More people at Dean Street go for PrEP, or what we call total bareback, which is if you're not going to do anything, at least test regularly so that when you're diagnosed HIV positive, we can get you onto treatment quickly. And what happens is, it's a bit like a VIP pass that gets texted to your mobile phone when you're least expecting it, saying that you can walk into Dean Street Express and test. And that's sent out monthly to encourage people to test. It also gives some advice around PrEP trials. We've also got something which some people know about, which is the grass is always grinder. If you look on our YouTube site, we've got a video which is based around 2 gay men, and it's discussing all combination prevention, and it's got loads of hits, particularly for some reason in Indonesia. I don't know why. So this is some of the content. Again, it's really important to us that we brand well, that it's in lots of different languages, this move to try and push people to get HIV to 0. So treatment is prevention. We were really early adopters at Dean Street. We hope that we can represent the community that we're part of, and people were coming in when they were diagnosed and wanted to start therapy really quickly. And it's no accident that TASP worked for us, because 50% of our new HIV is primary infection at Dean Street. So we knew that people had high viral loads, and it was important to get them undetectable really quickly. But this was happening throughout the UK. But the icing on the cake, really, was to introduce rapid initiation. So the standard pathway in the United Kingdom is to have all your tests sent. This alludes to the session that we had before lunch. And you wait for everything to come back, including the viral resistance test, which often takes 13 days. Then you come in for a chat to start therapy. We decided to start people within 48 hours. And in fact, it was not uncommon that people would be diagnosed and we'd start them that minute. And that had really a very significant effect on the median time to starting antiretroviral therapy. So at the moment, we start most people that we diagnose, well, the median number of people within a week. So PEP and PrEP. I'm sort of sighing because PrEP is quite problematic in England. So in other parts of the United Kingdom, it's provided for free on the NHS in Wales and in Scotland. In England, it's not. You have to be part of a research trial that's called the PrEP Impact Trial. And we've already got 10,000 people in the UK, in England, on the Impact Trial. About 3,500 of them come to our clinic. So if you want PrEP, you can buy it online, and Dean Street has provided and led, in a way, monitoring of people who are buying generics, particularly through websites such as I Want PrEP Now. We did, 4 years ago, set up a private service to sell branded Truvada, which we did on a Saturday, and people were flying in from Dubai to come and get their Truvada, but that's now stopped. And we used a model which was in additional private care. So this is common in the United Kingdom. For instance, if you have a cancer and the NHS can't provide the very expensive oncology drugs, then by additional private care, you get the standard of care treatment, but you pay for the drug yourself. So we argued at Dean Street that we could provide generic PrEP or branded PrEP that people pay for, but they still get the monitoring for free. So we're moving now, because we've got so many people on PrEP, to seeing people 6 monthly. And basically, this is an asymptomatic screen plus testing of your renal function. So it fits very nicely into the asymptomatic screening model at Dean Street Express, which is nurse-led. So this is my favourite slide. So the blue line is PEP. And we've seen PEP increase steadily month on month until generic PrEP was available, and then it seemed to stabilise. And then the green line is when we started the IMPACT trial. We were doing group consent to the IMPACT trial every half an hour in a room not unlike this. So we were bringing in about 30 gay men in particular. We were telling them about the trial, and then they would go to Dean Street Express to start their baseline monitoring and take their drugs. So we got a huge amount of people onto PrEP very quickly. And what I think is quite interesting, if you think of PEP as a sort of a barometer of risk, you were driving through a delta function in a way, and the PEP prescriptions that we gave out fell. Some of that is to do with the fact that people taking PEP were moving to PrEP. Some of it was that people were actually getting PEP from our service and throwing away their Altegravir and using it as Truvada. I haven't talked about other things that are new in STIs, which I think are important, but you can do that reading yourself. Mycoplasma genitalium is a bit of a nightmare at the moment. There's no great guidance, but we do the testing. It's not clear how we should manage patients. In terms of economics, when you are a gay man and you have a swab for chlamydia and gonorrhea from your throat, your bum, and a urine test, it's possible that you could all squish all the samples into one pot, and then we process them the same on the Gene Expert machine. There's some work about that. I'm not going to talk about it. We're looking at extragenital testing in women, so the idea that women may very well have a reservoir of chlamydia rectally, which, if we didn't test for them, might not be found. And, of course, topical, but we don't really talk about it very much, is doxypeps, the idea that people aren't just taking Truvada, they're taking doxycycline as well. And we know certainly that about 6% of our PrEP users are actually taking doxycycline. So that's it. This is the clinic. This is the consultants who are there at the moment, all looking very happy on that particular day. Thank you for listening.